Welcome, everyone. We're going to get started in just a minute here. Okay, well, welcome everybody to Real Balance Global Wellness Services Incorporated, to our free monthly webinars. And I'm your host, Dr. Michael Arloski, and I'm proud to say that I am now an NBC HWC, which, if you don't already know, is a National Board Certified Health and Wellness Coach. I'm proud of that because that's something I've been working on with a group of wonderful colleagues for quite a while. Real Balance is approved by the International Consortium for Health and Wellness Coaching and by the International Coach Federation for approved coach-specific training hours. We've trained literally thousands of people worldwide. And we offer these webinars once a month, completely for free. And then we archive them at our Wellness Resources section on our Real Balance website. And this one will be up in about 24 hours, and it'll stay there for maybe 2 or 3 months. And then it will go into our Coach Center, where our students and alumni can look at it forever. So the way this works is we bring you into the class, and rather than the chat function, we actually now want you to use the Q&A function to ask questions. We're going to leave about 10 minutes after the presentation for you to focus in on your comments and questions. And just want to let you know that in addition to the organizations I mentioned, we're also approved by many others. So check us out for the very best in health and wellness coach training. We have a really important topic this month and a really great presenter. Psychologist Joel Bennett is a former board member of the National Wellness Institute. He's been involved in the field of wellness for many years, and he is the founder and CEO of OWLS, that is Organizational Wellness Learning Systems. Joel, welcome. It's great to see you. Whoops, I think you're still muted. There we go. Okay.
Can you hear me now?
I can, okay. Yes. Yeah.
Happy to be here.
Yeah, welcome aboard. Tell us about how people can find out more about your presentation.
Well, just so everyone knows, we've been doing evidence-based wellness work to specifically address risks for employee substance misuse and abuse for 25 years. And this is just a list of some references that pertain specifically to the talk I'm going to share with you today. And if you're interested in these, let me know, and I'm happy to send them to you.
Mm-hmm. So we're talking about something that is front and center in America's mind. A lot of concern about this and a lot of quandary about what to do about it. It sounds like you have an alternative.
Yes, there's a lot to talk about. This is an article you can also ask for. It came out last month in WorkSpan. And the primary thing to focus on, given our time today, is that most of the discussion around addressing prescription drug misuse has been on what we call the supply side, the regulatory side, or what we call the crisis intervention side. Mm-hmm. There has been almost no focus on primary prevention and demand, what we call demand reduction. And mm-hmm. Wellness professionals, coaches are perfectly poised to bring in that part, primary prevention and so forth.
Excellent. So tell us a little bit about this approach.
Well, the primary idea is what we call health consciousness. And there's been some research on health consciousness, more as a trait and as a state than as a process. And I can get into all of that. But the basic idea here is that health consciousness is so fundamental to wellness coaching, well-being coaching. It's fundamental to the entire field of health promotion, but yet it hasn't been fully articulated. So while we talk about health consciousness in regard to preventing prescription drug misuse, it actually has much more universal
Mhm.
application. So what I'm going to talk about with you today is a model that we've actually been doing research on that breaks health consciousness down into three basic parts. Uh, and it's a process of increasing awareness in the face of potential risks to one's health. That's essentially what health consciousness is as we define it. And it's the desire and ability to stay conscious of one's own health is the primary driver. Accordingly, people who are health conscious recognize triggers that suggest they may be at risk, and then they take corrective action with protective factors, and that requires being alert to what's happening. That's the basic idea.
Okay. Yeah. So tell us more about this now.
Well, so we've created a grid that we use in our new course that we'll be talking about with the National Wellness Institute, where we train trainers on how to actually work this process. So in addition to your own level of desire and ability to stay health conscious and having the triggers and being alert, you also need to take corrective action. And that corrective action involves being aware of healthy alternatives. In fact, the wellness alternative is the basic idea that we're advocating here. The wellness alternative, prescription drug misuse, the wellness alternative. And then the last step is making responsible choices. So we're going to unfold this grid of how this process works.
Okay. Okay. I think you're so right on about the universality of this. I think as our coaches watch this, they can kind of keep that in mind as well as focusing in on this specific problem.
Yeah, that's the basic idea and why I'm so glad, Michael, you invited me, because I really think that this is a tool that coaches could use for any issue, as we'll get to.
Mm-hmm.
So basically, look at these items right now, and that sort of tells you your desire and ability. This is a way to quickly determine your level of health consciousness. Being attentive to your inner feelings about your health, taking responsibility, living without disease is important to you, seeking information when you're not healthy, knowing how to distinguish wellness products and services that are more effective than others instead of just buying whatever and doing whatever. And then, of course, making daily efforts. So this is a definition of health consciousness. And as I said, there's been some research on that.
Mm-hmm.
Now, there are four main triggers. This is where the prescription misuse comes in, that everybody has issues with. And if you've ever coached, you know that these four issues on the left pretty much are a lot of what wellness coaches have to deal with, right? Pain, problems relaxing, being hyperactive, needing more energy and focus, and feeling anxious and tense. Well, guess what? Because of what we call pharmophilia and the pharmaceutical industry, which we can get into, there are lots of great technological solutions to these four triggers. And so it's important to be aware of these triggers, especially when they get to a critical stage. So one example, Michael, we don't have a lot of time, is with regard to pain and opioids, a key trigger area is surgery. When people are going for surgery, dental surgery or whatever, that's an area where it's like, okay, I need to be conscious here of what the potential triggers are. And we all know situations where we're going to feel anxious or tense, or so that it's a question of staying health conscious is about being able to monitor these triggers.
Okay. Okay. Great. So one of the things that you do is really apply something that was developed by Bill Hetler way back in 1976 that the National Wellness Institute has been working with for all these years. There's many models of wellness, but this 6-dimension model seems to be one that you've adapted really well here.
Well, again, the course that we're doing right now, which is a certificate course, the train-to-trainer certificate course with National Wellness Institute, is designed to take this model and apply it to not only the 6 dimensions of wellness, but also to the national wellness competencies. So that when a person's a wellness professional, the whole person approach is critical to coaching and everything that we do in health promotion, the whole person approach. So what we're doing here in this slide is looking at these alert questions. So what can you do? What kind of questions can you ask that'll allow you to be alert? And you'll see here, and we're going to go through each of the 6 dimensions very quickly in the next slide. But the basic idea is, am I aware of or attuned to the arising or presence of issues in any one of the 6 dimensions? In this domain, do I experience difficulties with anything in those 6 dimensions? Do I need extra energy or can't concentrate because of an issue in one of those dimensions? And do I get anxious, tense, or have panic when I am doing something in those 6 dimensions? So we're basically, you can be alert in each of those dimensions by asking these questions.
Okay.
So we're not going to go into detail here, but Michael, you can go ahead and pick any dimension and we can go through it, and that'll give people an example of how this grid works.
Let's say the social dimension.
So am I aware of or attuned to the rising or presence of relationships that are difficult, that have grief or unresolved issues with others? Remember, that's the pain. So when we talk about pain, we just don't talk about physical pain. People experience pain because of social issues in their life. And then when you look at the next area, which is, go back a slide. My brain is problems relaxing, being hyperactive. Go ahead. So in this domain, do I experience difficulties with getting agitated? Do I get impulsive or feel awkward around others? When I'm around others, do I start feeling those feelings? And then in the next one, do I need extra energy or can't concentrate because I need to perform or be on for others?
Yeah.
And you can see how energy becomes an issue socially. And then finally, do I get anxious, tense, or have panic when I am with people or think about certain people or situations with certain people? So what you do is you take the 4 triggers that are relevant to those 4 psychogenic drugs, opioids, relaxants, stimulants, and tranquilizers, and you start realizing that if we can train people to be health conscious as a primary prevention approach of those areas where these things get triggered, right? Then there'll be less of a need to potentially have those drugs when it gets to the point where there's a doctor in front of them or somebody's saying, hey, why don't you use my drug? So that's the whole idea here.
Yeah, and I think what's really exciting is this next slide, because people usually, in our society, we get we don't know the healthy alternatives. So we reach for the bottle of energy drink, we reach for the prescription, or we twist the arm of our physician to get one, et cetera, and we try to calm ourselves down, juice ourselves up, whatever, grab another cup of coffee, whatever, rather than knowing what else we can do.
Yeah, and what's interesting about the healthy alternatives as the next step here, the corrective action, is that it's coming out of this prior inability. It's coming out of recognizing the triggers. It's coming from being alert. So it's not just doing a healthy alternative because it's the right thing to do or the nice thing to do. It's really part of a methodical building of consciousness. And the other thing that's important here is that many of these are known to be effective in the research literature. We know, for example, under social, there's all kinds of support groups, counseling, grief counseling, a number of therapeutic approaches that really help people with social pain, social anxiety, social performance issues. So that's important to realize that.
Yeah, and on the physical dimension, a lot of health and wellness coaches are working with people that have had hip replacement, knee replacement, all kinds of things like that, maybe work injuries, maybe, post-surgical, whatever it might be. And all of these other methods really help with pain management. And a lot of times people don't know about these alternatives.
Yeah, and I'll tell you, just a quick anecdote. I was talking to the medical director of one of the large wellness providers, workplace wellness providers, serving millions of lives, and they were concerned because their coaches, their wellness coaches, the telephonic coaches, when a client, an employee or a spouse presented with pain, the only protocol they had was, well, go talk to your doctor about that.
Right.
And
Yeah.
so we have a protocol now that coaches could use where it's not just go talk to your doctor about it.
It's more of a yes and. Yeah.
That's right.
Very good. Excellent. Very cool. So tell us about this final phase, the responsibility piece.
Yeah, this is sort of my favorite one, because if you have an epidemic, and we have an epidemic, and I would say it's not just an epidemic in opioids, but an epidemic of all kinds of prescription drug misuse.
Mhm.
It's not just about you, right? You know, it's something that's affecting public health. It's something that's affecting society. It's affecting children. That's what the nature of an epidemic is. So we have a responsibility, and we have a need to be conscientious and have some moral consciousness, especially if you're a wellness coach. So then you have to ask yourself, as a coach who's coaching a client, when you take a corrective action, is it helpful for you? Is it helpful for others? Is it helpful for the environment? Right? What are you doing? Is it right or wrong? Is it aligned with your standards? So that's the responsibility part here.
Yeah, is it effective or not? Like, one of the things I'm thinking is you have to consider an action, and how does that fit in with maybe a family situation? You know, are you going to get support from the family for that, or criticism? Or how do you gain support? Coaches can help people to discover how to do that.
So the idea here, when we think about consciousness, and this is from Ken Wilber's work, a lot of focus has been on waking up, you know, being more conscious, but to be responsible means also growing up. And we tend to focus, I think, a little bit too much in health promotion on the former and not the latter, that we have a responsibility. And we haven't been very responsible. And doctors are now admitting that they haven't been responsible with regard to how much prescribing they've been doing.
You know what occurs to me is that if you go back to the original wellness writers, Jack Travis and Don Ardell, they talked about self-responsibility all over the place.
Yep.
Absolutely.
And what's happened to it. So this idea of moral consciousness, again, I'm just reiterating here, is it helpful for you, for others, for the environment, and all of these? And so the final notes here, I mean, we can take questions, is just to kind of drive home this point. If our corrective action is always only good for us, consider another perspective. Our response to triggers may seem entirely private and personal. And this is sort of what I think the emphasis, and very important, that we never say in our work that if you're using prescription drugs, that's bad. We say if you're using prescription drugs, it's real important, and we can give them links to videos and other material on this. It's very important to understand that we want you to continue to use them as prescribed. And it's important that you understand that. All we're doing here is opening it up a little bit for you to consider some other way of looking at it. And the reason I mentioned that is when I've presented this a number of times, I've had, in one case, an employee come up to me and say, thank you so much, because I could not have come to work this morning if I hadn't had my Xanax. And you reminded me about my EAP. You reminded me of my need to get out, go walking. And so remember, there are people who are listening to you who the prescription drugs are a vital lifeline for them. It is really important. So you have to be very sensitive to not stigmatize, to not bash the pharmaceutical industry or anything like that. That's not what we're saying. It's a both and here.
Yeah, you know, I think it's really important. If coaches are going to be real coaches, they're going to be client-centered, they're going to be non-judgmental, they're going to be compassionate and accepting, but not colluding, you know? And I think that's what you're talking about here. It's easy to people in the wellness field to get that healthier than thou kind of attitude. And we have to watch that, especially on something like this, where it's so easy to be critical. Yeah,
it goes back to those healthy alternatives. People listening to this who, like, they're totally into essential oils and that's the answer for everything, or they're totally into this. So it's really the whole idea of health consciousness is not to get myopic or monomaniacal, but rather to help people become aware and alert and responsible, and to coach them in that way. That's what the purpose of the grid and these questions are.
exactly. Yeah, so this grid that you developed, I could really see coaches taking advantage of this. It looks a little overwhelming when you look at it, but really, when you follow it line by line, it makes a lot of sense.
Yeah, this is one of the tools that we'll be giving out in the course and walking people through this along with a whole curriculum that we've been doing and that those research that I was talking about earlier.
Mm-hmm.
So people
Yeah.
will have an option to get this certificate through NWI, which provides CEUs for chess, for ACSM, for Society for Human Resource Management, and employee assistance providers.
Mm-hmm.
So there'll be there's 2 webinars, 2 sessions that we do 2.5 hours and 2 hours a week apart. The first opportunity is March 14th. The next opportunity will be May 30th. And then we're also planning a face-to-face training in Anaheim in May. So you can go to this link here, nationalwellness.org, wellness alternative, or email me and I'll send you all the material so you can read more about it. And the fact that we've been doing research on it, those research papers that I showed at the beginning, including one that just got accepted to Journal of Applied Biobehavioral Health, Behavioral Research.
And what would your email actually be?
It's owls, OWLS, at organizationalwellness.com. Owls, OWLS, at organizationalwellness.com.
Okay, well, we've already got 3 questions in the Q&A. Great. And quite a few participants. So I really want to invite the participants to get into asking questions now and really go for that. Let's go ahead and take a look at this first question. Comes from Richard Warren. It says, in this model, how do you navigate what people in SA would say the addictive mind, that is irrational, focused only on the maintaining the high? Thus, in this, how can someone be conscious of desire, etc.? The steps, how does someone stay health conscious?
So I think, Richard, if I understand it, you're talking about someone who's already past primary prevention. It sounds like you're talking about someone who already, maybe he can clarify that, someone who's already has an addiction. That's what I'm hearing him suggest. So if he clarifies that, then either way, the model is really meant more for primary prevention. It's not a treatment model. In fact, we don't prescribe anything with it. At the same time, having worked with people who, and I've worked with addiction in my own work, the first step, the desire, right? The willingness, the desire and ability, right? So, is it Richard Warren? Is that his name?
Right. So, and he clarified, yes, you're on the right track in answering.
Yeah, so that first step is it pain? Is it anxiety? Is it the need for energy? Because it's finding out where the willingness is. And then, as you know, 12-step programs, it's all the first step is all about willingness. So I hope that answers your question.
Yeah, and Sarah Markham asks, the desire and ability slide and questions remind me a lot of the patient activation measure, PAM. It can be so useful to see how much responsibility and understanding a client has around their own health. As coaches, understanding the client's readiness and knowledge base can be helpful in matching their stage of change. So yeah, it kind of fits into all of these theories and models, doesn't it?
Yeah, I think all we're doing here, not to minimize it, is introducing this concept of health consciousness and really doing a deep dive into it. I mean, and so her comment's relevant in that, how does that PAM measure relate to helping people to get in touch with their own health consciousness?
Right. Well, I think really effective coaching, and the way we teach it with Real Balance, is to start out by helping people take stock of their wellness, to do self-assessment, and even help them with maybe more complicated assessments. So we're not just, what do you want to work on? What's the problem? How can we fix it? That's not the model. Instead, it's let's really take inventory here. Let's increase awareness. You're talking about the health consciousness there, really. And from that, then we have a much more clear idea of where we are, and then what needs to change to get to where we want to be. But it starts with what you're talking about.
Exactly. And the purpose of the NWI, the 6 dimensions, is that when you then are encountering that issue, that situation, right, back in your life, you're primed to know, oh, here's a place where I might feel anxious, right? Here's a place where I might not be able to focus because I'm distracted by something else. So it applies there.
Yeah, we're definitely open for more questions in the Q&A, so I really encourage people to throw some comments and questions in there. I just reviewed a book that Don Moss and I think it's Abigail McGrady are putting out on kind of a more integrative approach to healthcare and so forth. And they're working with coaches in a very integrated model where they're really working with the treatment team quite a bit. And one of the functions that these coaches have is to teach people some of these alternative methods, like the relaxation training, some of the different self-awareness kinds of models that you're talking about here. Here's another question from Vicky. Can you give an example of what to say initially as a wellness coach to a client who has just admitted to taking opioids or other addictive prescription drugs?
Yeah, that's a great question. Let's go back to the grid, the sample review grid for a second. Okay. Vicki, that's a great question.
Oh, is this one?
Yeah. So, what is it? And I will actually ask everybody to comment here. If you have a number of people in the group here, I would recommend everybody take a stab at answering that question. Again, it's can you give an example of what to say initially as a wellness coach to a client who has just admitted to opioids or other addictive prescriptions? I think the first thing is, are they taking it because it's been prescribed to them? That's the very first thing, right? Because if they're taking it illegally or if they're taking it in ways that are not prescribed, that would be important to know. So then if they are taking it as prescribed, you can ask them what was the dosage recommended and what did they have? Because you want to determine very quickly if they are at risk. And so that's the first thing. So there's other questions, but that's the first thing I would make sure to ask.
Yeah, Joel, what I might add to that is I think it might be a really important opportunity right there to build the trust in the coaching relationship by just asking the person in kind of a very empathetic way, wow, what's that been like for you? What have you been experiencing with that? So you're showing that you care and you're showing concern, and you're also asking them to reveal a little bit about what they've been up against with it.
Yeah, I guess what I meant by that is not the first thing, but in the conversation. That's why I wanted to put the grid up first, because the grid is really about helping them to explore where are you feeling the physical pain? Where is it? What is it about? So yeah, I'm in agreement with Michael, and because of our, what we know about screening, brief intervention, the level of risk.
Right.
You want to make sure that goes back to the responsibility piece.
Exactly.
You can't leave, Michael, you can concur here. You've got to establish trust, and you also, I believe, need to, from a responsible place, is determine whether they are at very significant risk, moderate risk, or no risk at all.
Yeah. I'm really glad Vicki McClanahan really shared that with us. A quick thing from Richard in the chat, and then we're going to start wrapping it up here. And I think this may be part of his submission for what might be said. He says, you're bringing up in our coaching, curious, what is important about this? what coaching around this. He's kind of writing in little incomplete phrases there, but I think he's on the right track there about, kind of establishing more inquiry with the client about this, and what's really going on. Well, unfortunately, we only have half an hour. I wish we had a whole hour on this topic, and with you, because you're an endless source of both fun and information, as usual. And I want to let people know that next month, a real important topic that many coaches have been asking about for a long time, and a class that Real Balance is going to be offering this spring, in developing your coaching business, especially from the health and wellness coaching perspective. There's lots of trainings out there for, business and life and executive coaches, but nobody's talking about how to do this for health and wellness coaches. But Annalise Evanson, who has an MBA, worked in Wall Street and everything else, as well as being a Reiki master and a fantastic PCC coach and all that, and one of our faculty members, she's going to be presenting on March 30th. So be sure to tune in for that. Sign up for our newsletter. By the way, our current newsletter has 3 articles on the social determinants of health. It's really fantastic. So stay connected with us. Check out my blog. You can take a look at realbalancewellness.wordpress.com, or on our homepage of realbalance.com. You can look at the little B for blog button and click on that, and it'll take you there. So please stay informed of all these things that are going on with health and wellness. Feel free to get in touch with Joel at owls@organizationalwellness.com. Check out NWI's website for more information about that upcoming class. And be well. Thank you very much, folks. Bye-bye now.